And there we go, it's 10 o'clock. Yay! Thank you everyone for joining us, and welcome to another webinar held on a Thursday at 10 o'clock and hosted by the Trucking Network. I'm your moderator, Chris Harris, Safety Dog. I'm a safety consultant, and I also host a podcast where I get to talk to some of the most interesting trucking people. With that, I would ask that Devine, our host, say a few words from the Trucking Network.
Yeah, thank you, Chris. Would like to welcome to Tom Wilson, Paul Gardiner, and of course, Chris Harris, and to all our attendees. Thank you for joining us. Every Thursday, we put together these educational webinars, 10 to 11. We are trying to stay connected with the industry and trying to touch those topics which are, really need to discuss. Yeah, today we will be talking about substance abuse in trucking. Not abuse, but yes, there is a lot going on, and it's highly used and in the truck drivers and even in the staff as well. So today we, Tom Wilson and Paul Gardiner will put some light on this. Chris, please.
And thanks, Naveen, for hosting this. We are talking about the impact of COVID-19 in the trucking industry, and perhaps we'll get into what's happening in the way of substance abuse. I would ask our guests now to introduce themselves. Tom Wilson, if you could introduce yourself and your expertise.
Thanks, Chris. Good morning, everybody. Naveen, thanks for putting this together, and Chris, thanks for hosting. My name is Tom Wilson. I'm a program consultant with DriverCheck. I've been with DriverCheck for about 4 years, and my role at DriverCheck is to help organizations put together or enhance fitness for duty programs. So centered around which fitness for duty is all encompassing. We include alcohol and drug testing, but we also have occupational health assessments, vast clinic network. And so we're able to pretty much facilitate any fitness for duty assessment that's required for DOT or non-DOT organizations. A lot of the conversations these days have been around COVID, so looking forward to this conversation because this is a pretty hot subject right now.
It certainly is, and thanks and welcome, Tom.
Thank you.
Paul Gardiner, would you please introduce yourself?
Yes, certainly. Good morning, everybody. My name is Paul Gardiner. I'm a registered psychotherapist here practicing in Ontario. And since about 2007, my specialty has been really in addiction. I've worked in inpatient treatment facilities, outpatient treatment facilities, and probation offices, psychology offices, and hospitals and whatnot. Around 2013, I became involved in organizational wellness and learned how the practice of treating addiction and helping people with substance use overlapped with folks in their employment, helping not only the individual employees dealing with those specific issues, but also helping organizations meet their needs for due diligence towards safety, and also just having good, practices, good procedures, and just helping their day-to-day operations run as well as possible. So our organization, Essential, provides EAP and SAP services. So basically wellness services provided by therapists for organizations. We work a lot with truckers, a lot of guys going and men and women going across the border into the United States who are regulated by the Department of Transportation, and also just domestic carriers that are doing their part in keeping the road safe and keeping their operations safe. And so, obviously when, we're supporting the mental health and wellness of people and helping folks with their substance use, this COVID situation has been really something. It's been significant, to say the least. And it's probably going to take a lot of time before we really understand all of the implications, all the repercussions, everything that happened with people's substance use and mental health. because we're in it right now. We're still in the middle of it, so it's hard to see. But these conversations are so important, and keeping these topics going is really helpful to everyone. So I do appreciate the invitation to participate today. Thank you, Naveen. And I'm hopeful that the information we share is interesting and useful for folks.
Well, I myself am really looking forward to it, because I really believe that, as you just said, we don't fully understand yet the impact, and yet I believe that there's quite a bit that employers can do. So we are going to be talking about the COVID-19 and how it's affected the trucking industry and changed the landscape. With that, Tom, can you tell us about COVID-19, the pilot testing program that DriverCheck took part in, along with Public Health of Ontario?
Yeah, I'd be happy to. That was a great program. It was actually inspired by a number of trucking organizations working in collaboration with Ontario Public Health. And we were involved to facilitate testing. It was a 2-month program, started in July, ended early September. I was actively involved in that. A number of my colleagues were actively involved in that. What we did was we went to truck stops, predominantly Flying J truck stops in London, in Ayr, and over towards Sarnia as well, in Tilbury. And we were there for 2 months on the ground. We had a number of organizations that actually stepped up and hosted. So they not only provided access to their employees, but to their surrounding community as well. So any organizations that wanted to provide access to their drivers were welcome to participate. The motivation was to simply that, was to provide access to these essential workers, these truck drivers that maintained employment pretty much throughout the pandemic so far. And the response was fairly overwhelming. I mean, I spoke to probably, when I was on the ground, I spoke to probably 50, 60, 70 truck drivers a day, approached them about what we were doing, see if they were interested in getting a test. We had teams on the ground, admin and a registered nurse that facilitated the test so they could actually get the testing done that day. We're reporting results to them within a couple of days, but really the response was I got across the board, I got a lot of colorful responses, but I also had a lot of people that were just genuinely appreciative, whether they tested or not, for what we were doing. But that program, that pilot to provide access, ended in early September. All that information is being consolidated, and we're with the ministry currently, and we're going to see if that's going to be implemented again, or how we're going to move forward to provide access to these essential workers, these truck drivers.
What I can imagine you walking around, approaching, as you said, 60 or 70 drivers a day. What was their reaction when you told them about COVID and the fact that they could get tested?
I think the ease of access, especially with us being right there at the truck stop, it was extremely convenient for them. We had a number of them. I don't know what the percentages are or what the actual numbers of completed tests were. That information hasn't been released to DriverCheck yet. But we had people that were drivers that were concerned about the test itself. It was a nasal swab, nasopharyngeal swab. So they were concerned if it was going to hurt, and then just the pandemic itself, some of the colorful comments and opinions, whether it was real or whether it was a conspiracy, but the vast majority, like I said, were genuinely appreciative of what we were doing, whether they tested or not.
That's awesome. I mean, I would hope they would, because I think that was a great thing that the Ontario government did to make it more readily accessible to truck drivers who would, I think, would have a hard time. And we've read in different publications as well, or I've read that sometimes they would have a hard time getting treatment because the doctors didn't want to see a truck driver because they haven't isolated for 14 days since returning from the States. So I think that was a great thing. What are some of the misconceptions that are out there about COVID and COVID testing?
Yeah, that there weren't really a lot of voiced opinions about misconceptions, other than, you know, just the validity of it. If it's a conspiracy, if it was real, those were small percentages. The biggest concern was really just centered around the test itself. If it was going to be painful, if it would hurt, how long it lasted, how long before we could get results. The actual test, I had it done several times. It's uncomfortable, but it's kind of like the sensation that I explained to them was that it's like swimming, and if you're swimming and you get water in your nose, it's that sensation. It's uncomfortable, but it was worth the few seconds that it was uncomfortable just to get the test.
Yeah, I mean, I haven't had the test yet, thank goodness, but my partner, she had to go. She's a dental hygienist, so she's also in a high risk environment, and I drove the car through the drive-through, and she didn't even flinch when they did it to her. So I don't think it's very painful. So
that was the case with most of the drivers too. Yeah.
Yeah. Has there been an increase in substance abuse? And this is one of my favorite topics, because I really believe mental health in the driving community has largely been ignored in the past. But with today in COVID-19, have you seen an upswing in substance abuse?
Yeah, that's a really good question. I think if you look historically at crises like we're experiencing now with hurricanes, particularly Hurricanes Katrina and Sandy, and the aftermath of those, the events of 9/11, we did see increases in misuse, abuse, or addictions. People that were vulnerable, that were susceptible to relapse, and those very challenging situations. And in the midst of these crises, we see negative emotions like anxiety and depression, probably stemming from boredom and isolation. And people that don't have the adequate coping mechanisms or resources maybe choose to self-medicate with alcohol or cannabis or other substances. With that said, and I'm not sure what to attribute this to, other than the fact that maybe in the trucking community, these guys have been working pretty much full tilt since the pandemic began. And within Driver Check, our statistics bear out that this year, we've actually seen a reduction in positives in the DOT world, which is awesome. Now, we've seen an overall reduction in testing volumes as well, but compared to workplace, where we've seen more individuals displaced, we've seen an increase in positives. So yeah, I think, and I'm not really sure what to attribute that to. If it's just the lack of these negative emotions being affecting truckers because they are active and they are working, but fortunately that group has not seen a real spike in positive test rates or results within the Driver Check community. Paul might have other information relating to that outside of our world, but you can certainly see there are reports coming in from Calgary and Edmonton and Toronto where you're seeing overdoses, spikes in overdoses since the pandemic began in March, or when it was declared a global pandemic in March. You're seeing spikes there.
And if I can just ask Paul before we really bring Paul in for some questioning, have you seen, Paul, an increase in the transportation community of abuse?
Well, I would say that it's early to make any definitive statements about what the impact is in terms of referrals for SAP program, for example. We'll see what happens. But, you know, Tom really nailed it when he talked about the additional stressors that are at play for folks. So it's not just people who might have had an active substance use disorder when this came around. It's folks whose coping was maybe just on the edge, and they're having more difficulty now with their coping. It's folks who were in a stable recovery, or at least in a really good place with their alcohol and drug use that was, you know, acceptable for them, where it starts to slip because of the additional pressures. And you know, the mental health component can't be really understated because it's so huge. Often we talk about people having a drug problem or a drinking problem, but really they are using it as a solution. It's their way of dealing with other stressors that would be overwhelming, loneliness, depression, that kind of thing. Anecdotally, we have seen across the board more referrals, and that includes, for our organization, not just people in the trucking industry, but in other safety-sensitive work. So we're a little bit busier. We're certainly busier on the mental health aspect of things, and in some places it's unexpected. So, for example, people having more problems at home, in their marriages, with their kids, with everyone. Spending a lot more time at home. This is bringing out some stress for many folks. Simple things like, you know, I'm thinking of a client that I was working with even just last week who had their alcohol consumption pretty well, you know, managed, under control. They were, you know, in a healthy range according to the low risk drinking guidelines. They started to basically stockpile alcohol because they wanted to limit the amount of time they were going out into the community and doing their shopping and activities. But that impact of having more alcohol at home it impacted their consumption in a negative way. So there's all kinds of these unintended consequences of the response to COVID in terms of the lockdown and that kind of thing. Which I think in the end is going to demonstrate an increase of the use of alcohol and drugs to help manage the additional stress. We'll see what the data comes down with, but you know, I definitely hear Tom's point that their organization is seeing less positive tests in terms of use in the community. I think we'll see that has gone up over this period, but we'll see. We'll have to wait and see what the data says.
Yeah. Interesting. Yeah, and I got more questions for you, Paul, but I'm going to hop back to Tom.
Sure.
And I say that, and I wish I would follow my script sometimes, as our attendees would know. There should be a script, and believe it or not, Naveen and I do have a script. And what I forgot to say is that Naveen and I are watching the chat closely, and I see that we already have a question in the chat. However, if you do have questions for our speakers, please put them in the chat, and Naveen and I, while our guests are talking, are watching the chat so that I can come back and ask those at the end. All right, Tom, what are some of the signs and the symptoms of substance abuse that employers might want to be aware of?
Sure, that's another really good question. Can I go back to what Paul said?
Absolutely.
Regarding the positives, I just want to clarify that we analyze positives within the DOT world and the non-DOT or workplace world. Specifically in the workplace, I think we've now these are workers that are being tested for various reasons. Reasonable suspicion, any type of incident or post-incident testing, pre-access testing, those types of reasons. And so we see reasons across the board, but they all fall into this positive testing pool. In the workplace or non-DOT world, as far as our positives, wild fluctuations since March. April, we saw a 43% increase in positives. So I think signs are there and I agree 100% with what Paul's saying as far as it may be a little bit premature to really determine what the impact on individuals' lives and their mental health, their substance use disorders. But we're seeing wild fluctuations in the workplace. I think July, with April up 43%, we saw a decrease of over 20% in positives compared to the same period in 2019. But we're about, for the year, our positives in the non-DOT world are up about 7%. Okay, in a decreasing testing environment. But getting back to DOT specifically, for the year, those positive rates are basically in line with where we were the same period last year in 2019. So I just wanted to kind of put some color and add some clarification to that too, that I think it is early, but at the same time, Paul, that you're having these conversations and being able to assist people that are seeking help, that are looking for help, is amazing. And segueing into signs and symptoms, I think managers and supervisors of staff these days have to be wearing a bunch of different hats, counseling hats and manager and supervisor hats. And with the luxury of having a relationship with your employees, I think the first thing that you're going to notice, and the easiest thing to determine any kind of change in lifestyle, or if there's a mental health concern, a physical health concern, or a substance use concern, is all going to be based on behavior. I think you're going to look to behavior first. Is the person distant? Are they maintaining hygiene? Or is there a lack of hygiene? Those types of signs are pretty easy to see. What's their performance like? Are they requesting a lot of time off? Are they late for work? I think with those existing relationships, it's easier to determine if there's a potential concern that you might want to approach and just have a candid conversation with somebody about. Without that history, or without that relationship, then classic signs of substance use are odors, if you can smell alcohol or smell cannabis, slurred speech, reddened eyes, lack of coordination, or in the case of certain substances that are stimulants, dilated pupils, dry mouth, things like that are more physical in nature and observed signs and symptoms of substance use or mental health concerns or something along those lines. We have to be careful as supervisors and managers not to jump to any conclusions about substance use. Some physical characteristics, diabetes comes to mind, have very similar physical effects that could be otherwise determined to be impairing and induced by substance, but it's a physical condition. So it's a conversation. We don't want to jump to conclusions, and it's all about helping these individuals, especially if they approach with a concern. And there are areas within the organizations, like Paul's, that provide access to assistance to help those people that are willing and looking for help.
Do you have, with a lot of people working from home right now still, even though we are starting to, a lot of us have gone back to work, there's still a lot of people working remote. Do you have any tips for supervisors in spotting substance abuse for those people over a Zoom call, for instance?
Yeah, that makes it challenging, especially if you're relying on that relationship. If we're having a Zoom call and you're talking to a colleague that has young children, didn't sleep at all last night, then he might be looking a little impaired. But again, not to jump to conclusions. So that, Paul, you might be able to jump in here and offer suggestions on how to handle recognizing signs and symptoms working remotely.
Yes.
It's challenging for sure for supervisors and managers to keep a finger on that and maintain health.
Well, especially just before Paul jumps in there, the liquor cabinet, if I was working from home, the liquor cabinet in my case would be very close. And if I was a cannabis user, of course, nobody would be observing me as I hopefully went out to my backyard, but had my cannabis in the backyard or have my edible, it wouldn't be so readily detected. So Paul, I'll throw it over to you.
Sure. Yeah. I mean, it is tricky. And let me tell you, I've worked with a lot of addiction medicine specialists. So these are physicians who are experts in detecting when someone has a substance use disorder. And they have admittedly missed at times diagnosing correctly. And it is because it's very tricky with substance use disorder. This is not something you can take a blood test and see, oh, well, this person is a, alcoholic, or this person is has cocaine use disorder or whatever. So my heart goes out a little bit to managers and supervisors, because it's a very difficult thing. So first of all, you do have those, all of those things that Tom mentioned, all of these physical signs that you might be able to pick up on, even on a remote call, because you can see the person. Another thing would be some of the performance. So are your employees showing up on time for these calls? Are they prepared with the material that they were supposed to have prepared for the call? Is there anything that indicates their performance has been impacted in some way? Another really complicated factor is that with substance use disorder, there's a lot of shame involved, and people will really try to disguise their behavior. They'll just disguise their impairment. And work, for whatever reason, is one of the last places that people will let their guard down. They will have their marriage fail, their relationships with their kids ruined, but they keep their job, for some, maybe just for some practical and pragmatic reasons. But so it's a very challenging thing. The organizations that offer training for managers and supervisors to recognize these kind of symptoms is still very useful. Some you can pick up over a remote call, but even in general, even in person, it's very challenging. I think one of the things that we think is very important is just keeping that line of communication open. But like Tom said, I think the very best thing, you can know the checklist of things to look for in the eyes and in the mouth and in the speech and all of that. But the very best thing is to know your people. And if you know your people, you know their baseline behavior. And then if something deviates from that, that's cause for inquiry.
And I think what you just said is very applicable to truck drivers, because of course we're talking mostly to trucking supervisors today, and they've always had to deal with this problem of trying to not diagnose, that's the wrong word, because we don't do that, but observe our remote workers, which is what a truck driver is, forever, basically. So, and you touched on it. I'll ask Tom this. What training is available from employers? Paul was saying that there is some out there. What is available for employers?
For employers, we actually driver check, and again, this kind of goes to what I mentioned in my introduction. Anything fitness for duty related, driver check is likely going to be able to assist. We have a robust offering across fitness for duty, including alcohol and drug testing and occupational health assessments, injury management. We liken ourselves or consider ourselves educational leaders. We have summits. Actually, Paul participated in our Fitness for Duty Summit, which is subject matter experts up and down an agenda, a 2-day agenda. And kind of part of that educational piece, we do have supervisor training for workplace and DOT supervisors and managers. So we can facilitate a, well, I've done these face-to-face, but in the world of a pandemic, we're doing them now remotely via Zoom. But we can provide access to training for organizations that feel maybe just shining a light on this and just sharpening the tools in that those supervisors and managers toolboxes to just hone in on what to look for and specifically behaviors, how to open up the lines of communications and stay in touch and just maintain that contact, especially when everybody is, a lot of people, I should say, are working remotely.
Yeah, thank you. And I have to agree. And I just want to bring Paul in, and we're all having, at least I'm having difficulties sometimes with COVID from a mental health perspective. It is unprecedented. I'm just wondering what impact you've seen on people's mental health and or substance abuse have you noticed since the start of the pandemic?
Yes, it's significant. And yeah, I would agree for myself as well. I mean, this is something that I'm managing in my own mental health also. So I think it's impacting everyone. So it's significant for everyone, in thinking about truckers in particular, the folks who come in for EAP or SAP assessment are certainly mentioning COVID more. It's certainly on their mind. And anxiety is just naturally increased with uncertainty. There's some good evolutionary reasons for that. If you hear a rustle in the bushes and you're a caveman, it's actually a very, advantageous, evolutionarily speaking, to be wary of what is rustling in that bush. And that's carried on to modern times, where when there's something that is, like you say, unprecedented and has a sense of danger, but we can't quite see it, this really raises our awareness, is a good way of thinking about it, and anxiety is actually how it is experienced by a lot of people. So folks are anxious and concerned. A lot of the folks that I've seen personally, and also that our other SAP assessors have seen, have mentioned the additional stress that's involved, especially going across the border, traveling through hotspots, known areas where there's a lot of transmission of this virus. So this has had an impact on people's day-to-day well-being as they carry this additional stress. And of course, it occurs on a continuum, right? Like different people have different strategies for coping and different natural abilities to deal with stress. But no matter where you are on that continuum, for most of us, this has been an experience of ratcheting up that anxiety. For some people, then that spills over into substance use issues, or it spills over into other behavioral coping that is problematic, which can even just be something as simple as anger and frustration coming out in the day-to-day when ordinarily it wouldn't have. One other thing I would mention is that for some folks, there's been an impact to increase their resiliency, which is, I'm thinking of truckers in particular who have really reflected on how important their role is right now in terms of keeping our supply chain moving, in terms of just bravely continuing with their work, which is essential. And this kind of attitude of connecting with your values, connecting with, you know, why what you're doing is important, even if it's causing anxiety, the reason why it's important, and you connect to that, you're connecting to your own values, that's an antidote to anxiety and worry and stress. That idea of contribution to not only your family, but to the community at large. These are things that I've seen also be helpful for individuals who have that resiliency response. But I would say across the board, it has been significant. And, you know, one of the best things we can do is encourage our coworkers and our friends and families to get assistance if they do need some assistance over this time.
And one of the questions or concerns that I have during COVID, I think I've coped relatively well, although certainly added stress and a little more short-tempered perhaps, as my girlfriend would tell you. But coming from a background of having some mild or not significant, at least, mental health issues in my family, and I'm thinking particularly of a truck driver now and perhaps their spouse. The spouse is at home with young children. They know that their husband or partner are significant, doing something really important, which I thank you, Paul, for pointing that out, that it can really actually act as an antidote. However, for the partner that's at home taking care of the children, they've got this cross-border trucker coming home on a regular basis. That must cause stress for them. What are some of the common concerns and challenges that everybody's dealing with during this COVID?
Yeah, I mean, I think it comes down to the uncertainty. It's the unknown. And sometimes that is much more difficult for the person who is staying at home. That resiliency response is still available to those partners. And we've seen this in our employee assistance program as well, where you know, you can connect to your values too, even if it's I'm maintaining this our household while my partner is away driving. So, you know, you can still connect to your values in those situations, but it's that overwhelming uncertainty. And also there's an understandable concern where, you know, everyone is isolating and that person you described might be isolating at home with their kids. But then what happens, you know, when their partner is back and they're not self-isolating, they've got another run to do the next day. It can be really challenging for families. And as I mentioned, I mean, one of the unintended things we're seeing is more family strife because of this additional stress as well.
And what role, as a psychotherapist, what role or what help can you offer to individuals or families?
Well, I'm really appreciative of that question because the truth is there is assistance that is available, and the strategies that psychotherapists or psychologists use are evidence-based. So we know that for most people, the majority of people, they will experience a reduction in problematic symptoms, and they'll also experience some degree of change in their behavior that helps to cope in a healthy way. So, I mean, for people who haven't experienced therapy before, we might have some like really old-fashioned ideas about, you know, laying on a couch and talking about your mother or something like that. That's generally not the way therapy works these days. It's much more practical. And so you'd be speaking to a therapist about a very common thing is talking about noticing your thoughts and responding to your thoughts. We have the idea that our thoughts are very important, but actually our mind is just evolved to generate this kind of what we call thinking all the time. It can be helpful or not helpful, but when we learn to notice that process that our mind naturally is captured in, it lets us disconnect a little bit from those anxious thoughts. So that thought of I'm worried of getting infected with this virus can, rather than getting really enmeshed with that thought, can become just noticing I'm having the thought of maybe being in danger from this virus. I might be getting a little bit too specific into some of the ways psychotherapists help, but it's a very useful thing to do, especially if you're experiencing some discomfort. I think generally that psychotherapists are going to encourage you to keep yourself busy. You know, if you were to report to a psychotherapist and say you were having a lot of anxiety and stress about COVID, for example, I think that they would, the psychotherapist would work with you to help find some strategies to stay busy, stay active, to stay connected with other people, and during this time of isolation especially, whether it's taking advantage of technology that we're so lucky to have at this time, but making those connections to other people to avoid the isolation. Depression, substance use disorder, a lot of those negative emotions, they grow in isolation and with loneliness. I think that there's a sense of needing to find a balance right now. For a lot of people, that means staying away from the news that is constant. And you know, COVID isn't the only bad news we got out there right now either. So having some kind of balance of staying in touch, but also turning off a little bit from that constant influx of bad news. So finding the balance that's right for you. I think psychotherapy at any time is going to encourage you to be kind to yourself and be gentle with yourself, not too hard on yourself, like stop the criticism right now. Of course, everyone wants to be functioning better and coping better, but these are literally, you know, once in a lifetime events happening with the pandemic. And so being gentle with yourself is a good idea. And then, you know, just a couple of other things a psychotherapist is going to work with you is just some of those best practices that we all know, and that it's sometimes hard to implement. So that's eating well, getting enough sleep, not drinking or using substances too much. If you can practice some kind of meditation, that's outstanding. And all of these things are not about being perfect, but if you can just add a little bit of improvement in those areas, that's going to help. That's going to help you out right now. And yeah, so psychotherapists have a lot of strategies and tools to tease that out of a person, so that they are deciding for themselves what's the best, the best way to behave right now, the best way to spend their time, and what they want to be putting their attention on.
Good. And that kind of leads us into, if you can explain what the differences are between EAP and an SAP program, and if you could start your answer with explaining those two acronyms.
Absolutely, yeah. So these are common programs available through organizations. EAP stands for Employee Assistance Program, sometimes called an Employee and Family Assistance Program. Now, larger organizations will have very sophisticated programs that have 24-hour telephone lines you can call and get connected with counselors and that kind of thing. Smaller organizations might just have an informal relationship with a psychotherapist in town or a psychologist in town that their employees can reach out to. So EAP is a voluntary program. People access it when they are having some kind of difficulty that they want to address with a professional. And it's totally confidential from the employer. So the employer provides the access to this individual or service, but the employer does not get personal information or private information. The employer just finds out they doesn't even know who accessed the program is how it is intended to work. So it's a confidential and discreet way that an employee, a driver, can get mental health assistance. And it's meant to be quick and easy. So that's the benefit of the EAP. The SAP program is different. That stands for Substance Abuse Professional. And this is not a volunteer entry program. This is would be mandated. The referral is mandated after someone has had an infraction of an alcohol and drug policy, typically. You know, SAP in the United States, or for any drivers that are crossing the border into the United States, that's a regulated term, and there's a specific credential that's required, and it's only specific people who have the specific training that can call themselves a SAP when we're talking about DOT regulated drivers. And in Canada, it is not regulated, but many organizations, because of their alcohol and drug policy or just their commitment to safety, will involve this kind of SAP program. So EAP program, one of the key things to remember is that because it's voluntary, it's not appropriate if you have a safety concern about a driver or an employee, because you won't know if the person has attended. So for example, if someone comes forward and says, oh, I'm really concerned with my cocaine use, it's starting to get out of control, and that person drives, you know, across the border, it would not be appropriate to say, okay, well, just go to the EAP and talk to them about it, because you've created a liability there. Say as a manager or supervisor, you know that someone has this potential safety issue, and you've sent them to deal with it in a way where you're not going to get any kind of confirmation that they've addressed it at all. So the SAP program, the SAP program, is that mandated channel for someone who comes forward and expresses a concern like that. Because once you are aware of that safety concern, it's important to have the accountability and the follow-up. So I hope that's explained the difference a little bit.
Yeah, I think so. And I've got a couple of follow-up questions, though. You are probably aware that, without making a political comment, we have Driver Inc. In a lot of our trucking world, and we have employees, truck drivers who are employees. Hopefully the employees have substance abuse and EAP programs, but a large number of those in the Driver Inc. world wouldn't have that readily available. Can you talk about how does somebody get help from both perspectives, somebody who's got benefits and somebody who doesn't have benefits?
Yeah, certainly. So, I mean, if you are in a situation where your company does have an EAP that's available to you, it's just a matter of getting the access information for that EAP. So hopefully on, you know, if it's a company website, or if there's brochures around, or speaking to HR, it becomes, you become aware that there's this EAP program. And that's great to address any kind of problem before it becomes more serious. If you're in a situation where you maybe don't have that service available, then we're looking to the community. A really great place to start is with your family doctor. Your family doctor is going to be able to help with any immediate concerns, any immediate crisis, and then the family doctor is also going to be able to refer you to a service that's going to be most useful depending on your specific situation. I think that you can also talk to friends and family, people who are trusted. You know, when you've gone through difficult times in the past, the people you've turned to and they've proven reliable, you can reach out to these folks as well for interim support, but also any suggestions that they might have in connecting with someone. If you are able to afford private connection with a psychotherapist or a psychologist, you know, I would suggest like checking that out. And the most important part of that relationship is the connection you have with the person you're working with. So there's a lot of research that demonstrates it really doesn't matter what degree you have, what type of psychotherapy you practice. I shouldn't say it doesn't matter. It matters, but the most important outcome is the fit you have with the person you're speaking with, and that what we call the alliance that you have with the therapist. That's the most important thing to look for if you're working with someone on these issues.
That's awesome. We've got about 10 minutes left. We have several questions in the chat that I would like to get to in just a second. But Paul, before we start throwing questions out to both you and Tom, any advice on what steps employers can do to support their employees during this pandemic?
Yeah, I mean, Tom might have some ideas on this as well. I think if you are able to offer employees some kind of assistance, whether it's a formal EAP program or even just a counselor in the community that you're aware of, that you trust, that you can let people know they can access, if you can fund that, that's even better. I think having clear policies around your COVID response is really useful as well. If it's in an office environment or even for drivers, just having whatever your expectations are clearly noted in way of policy, that's good. I think it's important for employers to be flexible at this time and understanding that their employees, their drivers, all of their colleagues, all of the stakeholders they're involved with are also experiencing this unprecedented, stressful time. And so having that patience, understanding, that's going to serve people really well. And then the last thing is, I think, just being willing to have the conversation. If you notice that someone is struggling, it can be uncomfortable to bring it up. If you notice some of those things that Tom had mentioned before about red eyes, blurry, kind of no eye contact, dry mouth, that kind of thing. It can be difficult to start that conversation. So I think during this time, just being willing to have a conversation, as you said, Chris, not diagnosing, but just keeping your observations based on objective things that you've seen and experienced. But above all, being willing to engage, being willing to talk, being willing to let someone know that there's resources available for them if they are struggling, without making any kind of diagnostic or judgment, just advising that there's that assistance available.
Yeah, thank you. Because, I look at it, this is a topic that really is near and dear to my heart. I've had a very close relative of mine was an alcoholic, a functioning alcoholic, and I've seen other mental stresses. So again, Tom, because Paul brought you into this question, he said, oh, Tom may have other answers. What steps can employers do to help support all, as Paul kindly said, all of the people in their organizations, not just the drivers?
The only thing I could add to that, because you covered pretty much everything that I would suggest or recommend, but I think, Paul, you would support this, that EAPs have, I think, notoriously been underutilized by staff. So the thing that I would add here to what Paul said is, first of all, if there's not an EAP, implement one, and if there is, just reinforce and promote, just so people are aware that, and reminded in some cases, that there are resources and access to help if they're looking for it.
Thank you both. I'm going to ask you some questions here. I think we kind of talked about this one throughout. What are some of the options that people, I'll say, and I imagine they're probably talking specifically about drivers, but what are some of the options they have to help them with their mental health challenges? That's from the chat. I'll throw it to Paul first, and then we'll come to Tom.
Sure, yeah. So, I mean, some of the things that we mentioned, a good place to start if there is no EAP program or no employee assistance available is with your family doctor. If you don't have a family doctor, now's a good time to, establish that relationship. It's a great place to start. And then also looking into the community for other services that might be available, the Googling, frankly, types of services that might be useful, and talking to friends and family that you trust, particularly people who have helped you out in a tough spot before.
And for people without benefits, there is like Ontario's telehealth. Isn't there a Canadian 1-800 number as well that can be called for mental health, Tom? Is that right? I just saw you nodding your head. So
yeah, no, certainly there are. I'm so sorry, Tom, but I was just going to say, yeah, there's actually many different places you can connect with just by searching online. Telehealth Ontario for people in Ontario. Yeah, that's a great one.
Yeah. Tom, something to add?
Yeah, I think it's, I think what Paul mentioned earlier, as far as just with limited access to resources, or at least perceived limited access to resources, just be mindful of self-care and surrounding yourself with people that you know, loved ones and friends, family, in these challenging times, and then make that contract with yourself to reach out and get help if you feel that you're kind of teetering on the edge. There's if it's not a workplace resource, then there are public resources, and I should say workplace or your family physician, like Paul suggested, if there is a lack of resources at work. But in addition to that, there's other areas that you can seek help and get quality help if you're looking for it.
Yeah, and thank you.
Chris, could I say just one more thing too, is to not give up, because there might be some roadblocks. Right now, there are some therapists who are at capacity because there is increased demand, not just from their occupational health world, but just you know, just in general, everyone is struggling, or many people are struggling. But don't give up is the thing I wanted to just put a tag on there. Keep having the conversation, keep looking until you find some assistance, because there is assistance available and it does help.
Thank you. And if I can volunteer, Naveen, I have some, because I did an interview on my show, I was given some resources, phone numbers and websites. I'll send those over to you so that you can include them when you distribute this, so that, and these are the free stuff that is available to people who don't have benefits. So, because I really do think this is, obviously it is an unprecedented time, and I think we are under a lot of stress at the moment, all of us.
Yeah.
Paul
I
Gardner?
think it's a huge topic, Chris. We can maybe have another 1 hour or 2 hour session on this. It's a huge problem, not only in general public, it's especially in truckers when they're away from home and isolated, and they have to, you know, work long hours, and you know, it's easy for them to get into, you know, but there is a help around, as Paul mentioned, and
well,
yeah.
There's two things that I'm really excited about that I picked up from this webinar, and it's great that one was from Paul and one was from Tom. From Paul, I just want to highlight the fact that doing useful work during this unprecedented time, this is not how you said it much better, but helps combat that feeling of stress. And that's what a lot of truck drivers are doing at the moment. Mm-hmm. And which leads me into Tom's comment that at Driver Check, at least, they've seen a decrease in positive tests. And perhaps that's the reason. So, you know, I'm very happy and excited to hear both of those because there's so much negative news around at the moment. Paul Gardner, I just want to say thank you so much for joining us today. It was a privilege to be here with you. Tom Wilson, also the same. Thank you so much for being here today. It was awesome. Naveen, please, some closing words.
Yes, Chris, I really want to add on this a little bit. It's a huge topic. I have a couple issues. I close people in my family too. So it is a huge concern. You know, it impacts the entire family, not just that person only. Does not matter you are a truck driver or you are normal like office work people, or it does. There are many more things which we can discuss today, but time is not allowing us. It was a 1 hour session. I will take a couple more minutes over that. Hopefully, maybe Chris, we can try to arrange another session on this. It's a huge topic, you know. Truckers it's a request to them. If you need help, if you feel like you are getting into that trap, please get help. There are help. There is help around available there, paid or unpaid. There are counseling. There is some medical help. If you feel like you really need it, please get that help and fix your own health and your family, which is very important to you and which is very much being impacted because of those your issues or concerns. So yes, I want to appreciate and I want to thanks to everyone who was in this webinar today, especially to Paul Gardiner and Tom Wilson. Thank you for sharing the knowledge with our attendees. Yeah, Chris.
And just before we wrap up, I ignored one question, and I apologize. And I don't know that, Tom, I think this is in your wheelhouse, but I'm not sure you will have the answer. The question is there a difference in positive substance abuse results between long haul drivers and local drivers? Does DriverCheck break that down?
You know what? We wouldn't distinguish between those types of categories. We would break down by substance. I think historically, cannabis is the substance of choice, followed by cocaine, pretty typically. But we wouldn't really break down long haul versus local categories like that. Unfortunately, to my knowledge, anyway, there are a lot of brilliant analysts at DriverCheck that may question that, but I haven't seen stats like that.
Okay, thank you. And with that, I would be forgetful if I didn't mention for everybody that next week we have the Fleet Safety Council's annual conference.
Sorry.
Thanks, Naveen.
Oh, no, sorry. I made a mistake here.
Oh, I thought Zoom was cutting us off.
No, I don't know what happened. Oh, my bad. Okay.
Well, it could have been worse. That could have been
Here,
earlier.
here's Chris.
Sorry?
Oh, Chris, you
There's
there?
Chris.
Chris, can you hear me?
Yes?
Yes, okay. Sorry, I click on something and it had to happen. Please. Yeah.
Okay, so did we hear that I'm talking about the Fleet Safety Council annual?
Just started saying that. Yep.
Okay, so please, Naveen's going to include the link in the show notes so that you can all register. It is a week from Friday, and Carolyn Mulrooney is going to be opening the conference. Jeff Wood, the Senior VP from the OTA, is going to be one of the speakers. Todd McGilvery, a VP from Northbridge Insurance, talking about transportation insurance, a very hot topic at the moment. Rui Fernandez from the Fernandez Hearn, the lawyers, they are transportation lawyer specialists. Be interesting to hear that conversation. And Lou Sumril, I can never say Lou's last name. It says from Newcom Media, but I know him from Truck News, will also be there. So join us next week for the Fleet Safety Council. It is virtual and it's free. With that, I'm sorry, we went over by a few minutes. We're 3 minutes over, but with that, I would like to conclude today's webinar with a huge thank you to Paul and Tom. Thank you both so much, and that's it.
Thanks, guys.
For coordinating this, guys.
Yeah.
Really appreciate it. It's a great message. Thank you.
So next Thursday, we are coming again. Next Thursday, our next webinar is on impact of COVID on our jobs market. So Angela Splinter from Trucking HR and Craig Fawcett will be our guest speakers. And hopefully we'll see you everyone again. Thank you again.
Sure thing.
Thanks.
Thanks, guys. Bye-bye.